Hello, everyone. I'm Dr. Deidre. Today, I'm conversing with Dominique, an advanced practice registered nurse, certified family nurse practitioner, and co-founder and owner of Purposely Evolving, a direct primary care practice. According to the Mayo Clinic, primary care practices that offer both HRT and weight loss services can enhance patient outcomes by addressing the interconnectedness of hormonal balance and weight management. Research indicates that hormone imbalances can contribute to weight gain, particularly in midlife. And integrating HRT with tailored weight loss programs can lead to more effective and sustained results for patients. Welcome, Dominique.
Hi, everyone.
So glad to have you here. I know we're going to learn a lot today, so we're going to jump right in.
Thank you for having me.
Most definitely. Okay, what inspired you to become an advanced practice registered nurse and certified family nurse practitioner?
Well, I've always wanted to have my own medical clinic. I wanted to give back to my community, those around me, help my family, my friends, and my loved ones, because a lot of times we're terrified. We're terrified to seek help from medical professionals or those that do not look like us.
Yeah.
And I wanted to give our culture and the people around me a comfort place to know that they can discuss their health concerns and get the help that they need without being concerned about if they're being treated appropriately, if they're being heard, if they're being understood, but also let them know it's a safe place for them. They don't have to worry about, back in the day when there was so many studies and trials and things that was done on them, if it's going to occur in the clinic that they're seeking, mental, physical, and emotional assistance from. So they really kind of pushed me, into the healthcare field. So,
Wow, so important to
yes,
hear that message.
yes.
Now, can you share your journey that led to the founding of Purposely Evolving?
Okay, so of course, I was a registered nurse first. I worked for one of the biggest companies here in Florida. So, as I was practicing bedside, I found that a lot of my patients were constantly coming back into the hospital. They were constantly getting, treatments that should have been prevented outside of the hospital. So, I decided to follow my passion, do what I love. So, I said, okay, I'm going to go a little bit further. I've always wanted to have my own clinic. I don't want to get stuck. So I said, okay, let me go ahead and go back to school. I went back to school, got my master's degree, became a APRN is what we call it, totally fine. APP, a lot of acronyms here, right? I decided as I was working for the companies that I was with, I realized that we were seeing so many patients in one day. And that was disheartening for me. We were seeing patients every 15 minutes. And a lot of times, patient would leave with more questions than answers.
Right.
I felt like it was about hitting numbers, bringing in enough revenue for them and their families. I was working a lot of hours, and I was working when I was on vacation or I had to miss my kids, like, basketball games, football games, track meets, things like that. A lot of my family life was, hindered. So I said, you know what? I really need to do what God put in my heart. I need to follow my purpose. So I also said, but I also want to change healthcare. And that's what a name came from. I wanted to purposely or intentionally evolve, change medical clinics. Medical clinic is the name. So it's purposely evolving medical clinic. So
Okay.
I want to change the way healthcare is given to our patients. I want to change how they feel and what they think about healthcare. But I also want to help change their lives so they're not just going round and round in the same circle. Let me put a band-aid on it without actually fixing something. So that's kind of how the name came about because I wanted to change the way things were going in healthcare and try my best, even though I know I'm one person, to try my best to change the perspective of healthcare.
Oh, wow. And I can
Yeah.
tell you are intentional about your purpose. So
Yes.
let me
Yes.
ask you, yes, what sets Purposely Evolving apart from other medical clinics?
Besides the fact that it's me,
A big
I
plus.
think I think because I am very passionate. I'm
Okay.
not there just for, a dollar. I'm not just there just to see how many patients I can get or to, use their health against them. My practice is different because I do not do 15-minute appointments. So I have my initial appointments are about an hour long. I take my time and I talk to my patients and see what's going on, what I can help them with, and really hear them out. And then my follow up appointments are 30 minutes. So I don't have any 15-minute appointments. And I take my time and I care for them. With the direct primary care, that model is a newer model. So this model being new, it gives the patient a connection and a relationship with their provider. So they're able to talk to me on the phone. They're able to send me emails. They're able to send me messages on their patient portal. They're able to come see me when they're sick without worrying about having to wait 2 to 3 weeks to get in. Okay, you're sick, you don't feel well. Let me get you in today or the next day. So I try my best to set myself apart by actually listening to my patients, understanding them, and try my best to relay my passion to them, to know that you getting better is what I care about, not how many times I'm seeing you. I just want you to get better. And at least amount of times that I'm seeing you means that I'm doing something right and you are getting better.
Wow, I'm gonna tell you that is so important in a medical field because a lot of
Hmm.
times you don't feel those good bedside manners. You
Hmm.
feel like, you are just a number a lot of
Hmm.
times, but that personable approach that you're taking is so important. All
Yes.
right. So, hormone replacement therapy, it can
Okay.
be a complex topic. How do you explain it to patients who are new to the concept?
It is very complex, but we all have hormones in our body. So when someone asks me if hormones is good for them or tell them a little bit more about hormones, I tend to tell them the things that your body lacks or depleted in is what I'm going to give back to you. And I'm going to give the same things that's really low that's causing you to feel, tired and weak and having you gain weight and energy is low and for women having the lack of libido or hot flashes, for men they're not sleeping well. All of these can be intertwined. So I always try to tell them the symptoms that you're feeling is because your hormones are starting to deplete and they're not giving off like they should. So what I do is I give you the hormones that your body needs so it can start working as effective as it was previously so it can wipe out those symptoms that you're having. But try my best to not, give you too much or too little of anything that can cause side effects or any adverse reactions or things like that. So I try my best to explain to them I'm not giving you any synthetic hormones, which are a lot of studies are based off of
Okay.
synthetic hormones and if it can cause cancer. So I tell them I give you the hormones that are as identical as the ones that's in your body. And those ones will help turn the key. So it's just like having a key to a lock. I'm going to give you the hormone that's going to not only fit into the lock, but also turn it to open up those doors to release all of those symptoms you're having. Instead of a hormone that's synthetic that can go into the lock, but not really open up anything. And you're still
Mhm.
having all these symptoms. And now you're having side effects from those hormones that wasn't meant for your body in the first place. So I try to explain it to them like that, hoping that they can understand a little bit better.
Wow, this is some incredible information.
Okay.
So, let me ask you, but what are some of the misconceptions about HRT that you encounter in your practice? Now, I just heard you say that people think, oh, I might get adverse reactions
Hmm.
or, it's synthetic. Can you clear up some of those misconceptions?
I can try my best. It's
Okay.
really, really tough because you've had multiple studies that came out that say, oh, estrogen or progestin can cause breast cancer or, endometrial cancer, ovarian cancer, or prostate cancer. But those studies were done on synthetic hormones. No one
Okay.
talks about the breakthrough studies that shows progesterone, which is different than progestin, that can't protect your uterus, or estradiol, which is different than estrogen. And those are the ones that's more bioidentical to your body, to the lock and key method. So when people say estrogen, I wait for them to explain what type. There is multiple types of estrogen, but you want to go with estradiol. Those are the ones that does, the most effective and efficient way of like taking away the symptoms that the patients have. Those are the ones that helps with our energy. Those are the ones that helps us with our reproductive system. So you want to explain to them there's multiple types of estrogen. There's estradiol, there's estrogen, there's estriol. You want to explain which ones they actually need and tell them you want to do the ones that is closely related to the ones their body produced. Those are the ones that's least likely to cause cancer, which you hear that a lot.
Yes.
And actually, it protects you because you should not. Now they have a study. You should not take estrogen or estradiol without taking progesterone if you have a uterus. Because if you have a uterus, the progesterone is going to protect you from having any endometrial cancer. But most people automatically think if I take estrogen, I'm going to get cancer. That's not true. So I try to explain to them the best I can. I try to send them studies after we have a talk through their patient portal or email or print things off so they can go and research these studies on their own and let them know like your hormones do affect a lot. Some people are depressed, they have anxiety, difficulty losing weight, they're not sleeping well, and all of it is related to their hormones. So
Okay.
fixing those things can negate a lot of the way that they feel, if
Okay.
that makes sense at all.
It does. And Dominique, let me say, I love that you educate your patient. That's so
Hmm.
important. That education piece is so important for
Hmm.
patients or anyone who wants to learn more. How do you determine if a patient is a good candidate for HRT? As a breast cancer survivor, would it be right for me?
So for most patients, it totally depends on the type of cancer they had, the
Okay.
type of treatment, if their oncologist is on board. But if it is estrogen prone, testosterone prone, like if there was, prostate cancer, things like that, then it's a possibility that they cannot go on it. So a lot of times hormones, what it does is it increases or what we call proliferate or make, some cells multiply. And if that happens with the wrong types of cells, it can cause, certain cancers. But again, that's more so with the synthetic hormones. So some women who's had cancer can get topical treatment instead of oral treatment or injections. So it just depends on the type of, disease factors that they've had. If they've had uncontrolled high blood pressure, you want to get their blood pressure controlled first. If they've had, prostate cancer, which is interesting. Now you have studies coming out saying it's okay for you to give them testosterone. They don't have a prostate anymore.
Oh, wow.
So a lot of that makes a big difference. Your family history, so I dive deep into your family history. I dive deep into your surgical history. If you've had, birth control before, how you're feeling. So if you have a lot of disease factors that would say this is a no for you and it's going to cause more harm than good, then I wouldn't give it. I'll
Okay.
decide it's not a good treatment. Let's try something else that can combat those symptoms. Because there are other things out there that can combat the symptoms of menopause.
All right. Okay.
Hmm.
Now, when a patient asks if HRT can make them feel 20 again, how do you gently break it to them that time travel is not a part of the package?
So I can tell them I can try to get as close as possible, but
Okay.
but a lot of times, especially my men, they want to go back to when they were 20 and 30. So I tell them a lot of times I don't think I can get that close. So some
Right.
things are just impossible. But I tell them it will help them feel better because a lot of men, when they don't have testosterone, they don't, their libido is really low. They're not getting erections anymore. Their sexual health is in the toilet. So it's not about what they're doing wrong. Sometimes they just need a little bit of help. So I tell them if I give them this to give them a little bit of help, and you do see where, relationships and marriages, is so much better. I always tell people I save lives. I not only do I save lives, I'm saving marriages over here. Like
Right.
hormones are saving marriages. So it really do help a lot. It helps with their sexual health and their sleep and everything. So
Mhm.
I can't take you back to your 20s, but I can try my best.
All right. Okay. Now, let me just say that some people don't need to go back to their 20s because we
No.
don't want them to, in the process of feeling good, have heart attacks out here trying to live like they back in their 20s. So, that's a whole nother
Yeah.
story, but yeah. Okay. Now, can you share a success story where HRT significantly improved a patient's quality of life?
Yes. I,
Okay.
I actually just had a guy, one of my patients, he's been with me for 2 to 3 years now,
Mhm.
and he suffers from PTSD. He is a vet, and he was on, multiple medications for his post-traumatic stress disorder, anxiety, depression, multiple things. And he also has really bad osteoarthritis and back pain and knee pain. And I told him about, hormone replacement therapy and how it works, and it can help him with a lot of his mental problems or things that he's going through. And he was taken aback. He wasn't sure. He didn't want to take anything. He was only on medication for like his blood pressure, and he was only taking medication like over the counters for like when his knee or his back, bother him, like ibuprofen or, Advil, things like that. So I explained to him exactly what it was. He said, okay, let's try it. So now he's been with me for 3 years, and now he is not having any like episodes of depression where he's like isolating himself. The PTSD is completely controlled. He's not on any psych medications anymore. He's working out now. So his back and everything is fine. He's lost weight. And I recently received a gift from his fiance.
Oh,
She gave me
wow.
some things. She was like, "Oh my God, I've never seen him like this." And they've been together for 5 years now. And she brought me some wine and a scarf and some chocolate. She just wanted to say thank you.
Right.
So seeing the difference with him, it lets me know what I'm doing is working. And he just needed to be, educated on the matter. So that was really, really big for me. That was big
Most
for me.
definitely.
That
You
was
are
big.
changing lives, saving
Yeah,
lives, doing it all. Okay,
that was
improving
big.
lives. Yes.
Yes.
Okay, so let me ask you about weight loss. Weight loss can be a challenging journey for many. How do you approach weight loss management in your practice?
So a lot of times people come to me when they have gained, 20, 30, 40, or even more, and they are down, they're sad, they're depressed about it, they can't fit their clothes. They're just like, I don't know how this happened. And I just go back to the basics. I let them know, weight loss is all about, your input compared to your output. It's a numbers game. I tell them there's no quick, easy fix because a lot of people think, you can just work out for a week or two, or you can, eat well just for a few days and it happens, or you can take all of these, these teas and, all these different things, colon cleansings, and next thing you know, your weight is gone. I let them know that it's a lifelong journey. Obesity is real, and 80% of their weight loss is going to be in the kitchen. I harp on that from the beginning. Most of your weight loss is going to be in the kitchen, 80% of that. And this is about a lifestyle change. There's no magic pill or shot. Is there medications that can help you? Absolutely. I provide them, I give them. But they are a tool. It's a tool to help you get to your goal. It's a tool that will help you get to the lifestyle change that you want. It's not, I'm going to take this medication, get to where I need to be, stop, and then I'm going to go back to doing what I was doing previously. It doesn't work like
Yeah.
that. So I always tell people it's about a lifestyle change. I want to help you change your life so that the weight does not come back on. I don't want you to lose the weight and then you go back to doing what you were doing previously. So I always approach it with, this is a lifelong battle. This is not a quick thing. It's nothing that's going to happen overnight. I want you to give yourself time and grace, but I also want you to know that it's all about 80%, I should say, is about what you eat. It's about, you can lose that weight with your eating, how much you eat. And the 20% is about working out and being consistent. So I try to approach it in that way so the patients can understand, okay, this is not going to happen next week. I have to take my time. I have to change the things that I was doing because what I was doing was harming me, and change it to a more healthier lifestyle without restricting myself so severely that I go back to those old, lifestyle change, those lifestyles that I was doing previously,
Most
or the
definitely.
things I should say I was doing previously. So
Okay, so we know that mindset plays a big role in
huge.
successful weight loss. So, how do you support your patients in this area?
So I always encourage them. That's another reason why my practice, I would say, is different. I'm not just giving you medications and letting you go.
Okay.
Right? So I give them the whole picture. I do a complete lab workup on them. I do a complete nutritional consult with them. I do body compositions. I do body measurements. Yes, their weight is a big factor, but internally, and that we have to see what's going on that's stopping you from losing the weight. And then I talk to them about how they're eating, how much they're eating, how to eat effectively and efficiently when they're out and about and when they're traveling. So what I do is I just start from the bottom and I work my way up. You know what I mean? And I just let them know I'm not going to just give you medicine and let you go. So I really get down to what they say, the foundation of why, and I explain to them. And I think once they understand what's causing the weight gain and what they can do to prevent the weight gain, the weight starts to shift because they're like, I don't want to stay in this cycle. Obviously, I am eating way more than this, I'm doing that. It's not working. I need to change some things. And I encourage them. A lot of people are so discouraged sometimes about weight loss. I tell them it's okay. It's a myth that you don't need help and you just only can do it with food and exercise. Sometimes we need a little push, and that's okay. And I give them that little push, and then they don't need it anymore, and then they can keep it off. But sometimes you need a little help. So I try to really educate them. I'm really big on talking to my patients and educating them as much as possible so that they can. But if they have really bad depression and anxiety from the weight, I would try my best to treat it. And then when the weight start coming off and they start getting better, then I can wean them off. So it's multifactorial, but I try my best to educate like as much as I possibly can. I'm really passionate about that.
Yes, and this is a comprehensive plan for
Yeah.
anyone who is, looking for HRT or even to lose weight. I mean, you're
Hmm.
so comprehensive down to the
Hmm.
education, down to the
Hmm.
motivation and encouragement. I love it. So let me ask you now, how do you stay updated with the latest trends and developments in weight loss management?
So there's always new studies coming out. I have multiple ways of reading the new updated studies that's coming out, staying updated with the FDA, making sure that, my I always say my ears to the ground, like the kids say. Just been looking at some of the TikToks or videos or, just all the things. You want to just have a complete, like outlook on things. You don't want to overlook them because you think they're minor. So I try my best to always read the new studies coming out. I always have a book in my hand of some sort, whether it's my Nook, whether I'm reading a guideline that just came out, a new study, a new cardio, but anything, I try my best to, because I have to. I
Yeah.
have to know what's going on in the community and with healthcare changes all the time. So I'm always educating myself, doing continuous education, just to make sure like I have everything at my fingertips so I'm not blindsided about the new trends and the new medications and the new workouts or the new the new teas that everyone drinks to help them lose weight. So I try my best to, keep myself open to whatever comes out so that I can know what's going on.
All right. Now, besides push the fork away, what's the most surprising or unconventional weight loss tip you share with your patients?
I always tell them to, and people, they shock when I said, don't restrict yourself.
Okay.
So people tend to think I do not need to have any carbs. The carbs is what's causing me to gain weight. No, it's your portions. So people are like, wait, what? So I can have a sandwich or I can have chips or I can have, you can have just about anything you want. It's about how much you're eating. So when they come to my clinic and I tell them, I don't expect you to only eat 500 calories a day. Let me tell you what your body burns, and I can tell you how many calories you can eat a day, but I want you to eat as healthy as possible. Let me tell you how many you can burn, and then we can go about what you can have so you don't have to completely restrict yourself. So some people think when they're losing weight or they're dieting, they can't have any other good stuff. Not true. I tell them it's all about portions. If you can eat according to your portion sizes, you will continue to lose weight effectively, and you do not have to feel the urge to want a whole cake or a whole bowl of ice cream. But if you have a little here and there, it's not going to deter you from your weight loss. You just, unfortunately, you don't know how much you can have, or you don't understand that it's about your input compared to your output. If you're taking in more than what your body can burn, it doesn't matter how much exercise you do or anything like that, you're not going to lose weight. But if you are taking in less than what your body can burn, you're going to continuously lose weight. And it doesn't matter how, what it is, but how much it is. So people get shocked by that. It's not about just not having no carbs and no fats. And no, it doesn't work. You have to do something that's lifestyle, that's going to change your lifestyle, but what's sustainable throughout your life. You can't go your whole life without having, some chocolate or a glass of wine or some popcorn. It's impossible.
Yeah.
So something that can actually change. That's why I say it's about lifestyle changes. It's not about completely not having anything for a short period of time. You want it to be sustainable.
Exactly. All right.
Yeah.
So let me ask you, what's the most creative excuse you've heard from a patient who didn't stick to their weight loss plan?
Oh man, let me see. What do we have? We have a lot of excuses going on here. I haven't heard the dog ate anything yet, but
Okay.
I, like, people always I always tell people no matter what excuse they have, is we all have one.
Yes.
And it's totally up to you to determine whether or not you're going to let that deter you or not. But people use the fact that they travel a lot, the reason why they gain weight. But I tell them, every place has something healthy.
Yeah.
You can walk, you can park your car far away and walk up, you can, lift your own luggage, you can go for a walk in your hotel room. You can decide instead of, I know they just buying us all of these subs and things like that, I'm going to have half instead of a whole. People come up with, I mean, that's a hard one. People come up with a lot of excuses. So it's kind of hard to say words, but they're pretty
Okay.
wild. They can be pretty wild.
Okay. Yes, I can imagine. All right. Now let me ask you, what's the most out there weight loss fad that you've seen?
Let me see. I think it's the I think it's the whole laxative ordeal that's going
Oh,
on right. So it's a lot about like different things that they take in that really makes them go to the bathroom a lot. Like all of the slim teas and the waist trainers and the let me take this to make me go to the bathroom. Those aren't the those aren't really good to do. Number one, I always tell them, you notice after you're done, the weight comes right back on because you
right.
didn't change anything,
Mhm.
or the teas are going to just have you sitting on the toilet for a long matter of time, and that's not something that you want to do. It's not healthy for your gut,
Right.
and that's not something that's sustainable. So it's going to help you look slim for that weekend,
Right.
but it's nothing that is going to work like lifelong. So like I think the teas and the waist trainers are some of the fads that would get me. I'm like, we have to do a little bit more than that. If you're going to still drink the teas and then wear the waist trainer, but then you're still going to have, 8 fried pieces of chicken and two slices of pizza and some milkshake, it really doesn't matter. You're gonna gain the weight right back. So, you have to change something, is what I say.
Right.
Yeah. Yeah.
So, if you could wave a magic wand and give every patient one healthy habit overnight, what would it be?
That's a good one. I have two actually.
Okay.
I would say drinking enough water
Mhm.
and actually exercise. And this is why, because I know people say, well, everybody say that. Water cleanses you. Water is our friend, right? From
Yeah.
your hair to your nails to every organ, right? Water is our friend. And yes, it helps with weight loss, but it cleanses you after you go to the bathroom. It is overall your friend. But working out, I don't care if it's 10 or 15 minutes.
Mhm.
And you don't have to do it every single day. You only need 150 minutes a week, right?
Right.
To hit your goal.
Right.
It helps with depression. It helps with anxiety. It helps giving you vitamin D, which most of us is, deficient in. It helps burn calories. It helps for your body to continue to burn calories and get some muscle after you're done working out. It is the most underused drug in America. So
Wow.
exercise is huge. I'm like, it's so underused. They'll give you every medication under the sun,
Mhm.
but pushing working out and drinking water is so underused and underrated.
All right. You heard it.
Yeah.
Dominique is preaching and she is giving us
Yeah.
she is giving us the business that we need today. So,
Yeah.
all right. Now, let me ask you this. What has been the most rewarding aspect of running your own practice?
I would say my family time. I
Oh,
used to work so much. I used to miss so much with my kids.
yeah.
But the last almost 3 years let me see that I was giving up so much for other people in their businesses,
Mhm.
the big
Yes.
corporations, and bringing my computer home and charting at home and missing all of the football games and not being able to, scream my head off for my husband at his games and because I'm working. No one cares about that. Your kids are not going to remember how much money you made or what you've done for someone else if you have missed their entire lives.
Right.
So when I say it changed my life so drastically, it really has. I don't miss any basketball games, any football games. I don't miss any track meets. I'm able to spend time with my kids as much as I possibly can. Even when they want to leave me and run upstairs and play on their video games half of the time, especially my boys,
Yeah.
I'm able to be there.
Mm.
It Oh my God, it changed my life so much. And I absolutely think it was the best decision I could have ever made for myself. Like running, like just being able to say I can be with my family. Yeah, yeah, that's what made it so worth it for me.
That is huge.
Yeah,
And
it
I
did.
love that you said that, because kids today, they may be in their rooms, but they know that you're there, and that's the
Hmm.
important piece. They know that your presence
Yes.
is in the home somewhere. So that is great.
Yes.
All right. So let me ask you, how do you handle the challenge of being a business owner as well as running the practice all at the same time?
It's hard. I
Yeah.
tell people, some days I'm working in my business and other days when I'm not at work, like now I'm working on my business. So you have to find the time to make sure that you are effectively treating your patients. Those are the days that I'm working, but also making sure people know that you're there for them. You're in the community. It is very challenging sometimes. I'm not from the community. Like, I'm not from here. Born and raised in Chicago, went to the University of Iowa, met my husband in Iowa. He's from Florida. So we moved back to Florida mostly for that reason. And I love it here. But when you're not from somewhere and you don't have any community ties, it can be very, very hard to launch and create a successful business because no one knows you, right? So I'm literally starting from the bottom. Not having family or friends or loved ones here besides my husband's family, who has been so immensely supportive of me, but not having that here a lot of times can be very challenging and hard because the community, they don't know you. They
Right.
didn't grow up with you. You didn't go to school with their kids, or their kids don't know you. So letting them know that you're here and you actually want something that's good for them and you are different is hard to persuade that to the masses. It's really hard when you're not from a community. So I think for me, it's really hard just about getting in the community and letting them see that I'm here so they can know. But I have to first set a foundation. So now that my foundation is set with my business, I think now I'll be able to get in the community more and let them see that I'm here. I care for them. I'm not a conveyor belt where just 5-10 seconds I'm in and I'm walking out. I'm letting them know that I actually care for them. I think it's going to make a difference. But right now it's just hard about building.
Right.
That building phase is has been very tough, but I'm not letting up. I'm here for it.
Right. And I
I'm
hope
here
that you
for it.
don't. And I want
Me
everyone
too.
to get to know Purposely Evolving Medical
Yeah.
Clinic and Dominique because she is real in what she's doing for patients.
Yeah.
So let me ask you if you could prescribe one non-medical treatment that
Yeah.
everyone should try, what would
Yeah.
it be?
Okay. I would go back to the water and exercise. I would
Right.
say that's something that you can do on your own without anybody. You don't need a medical professional to tell you what to do or how to do. You can just get out and start walking.
Yes.
You know what I mean? Every time you think about it, get you a bottle of water and drink it. Like, that is something that, like I said earlier, is so underrated. So I definitely would say that. I would still stick with that answer.
All right. So I know my husband and I, we have now I can't beat him in the exercise game. He has that one down pat. However, I get mine
Okay.
in, but we always have like a little friendly wager about the water intake. So,
Oh yeah.
you'll see us at any given moment finish a bottle of water and throw it around the house, like, all right, go get that one.
Yeah.
So it's just us
Yeah.
getting our water in, but making it fun. So I love that.
Yeah, you have to. I always
Mhm.
tell my kids every time they say, "Can I have this? Can I have this?" You can have some water.
Yeah.
So now they always say before they ask me anything, some water, right? I'm
Right.
like, "Yep." Get some water first. Talk to me after. So
Right.
it's definitely something fun to do with the family. I just think it's really good for it's good for you. I know people
Yeah.
don't want to always hear that, but it is.
It is. It is. And you can occasionally have your sugary drinks, but I always tell myself that if I choose to have something, I will follow it with a bottle of water.
Yes, yes,
So
nothing's
that's
wrong
so
with that.
important. Yeah.
Absolutely.
All right. So now what's your guilty pleasure when it comes to food and how do you
Oh
justify it
man.
as a healthcare professional?
You want me to tell all my secrets, huh?
Yes, tell your business. Go ahead.
so, so my pancakes.
Oh,
So
wow. Okay.
I know it's with the syrup and the butter, absolutely. And my husband sometimes he asks me, it could be weeks without it, but when I have it, I love buttermilk chocolate chip pancakes. I always tell my husband, I know I'm addicted, so I try to not have it once a week, but most of the times I do. And he'll say, it's normally on the weekends because we're pretty busy. You want pancakes today? Absolutely. I'm not going to say no to that. You know what I mean? I
Yeah.
absolutely love pancakes. That's, I always say the way to my heart. Like you
Mm,
ask me what I want for breakfast, pancakes. Of course I'm going to say
right.
pancakes, right? But most of the times I don't get a chance to, cook them in the morning when I'm going with the kids and the hubby in the morning because our morning routine is a little crazy. But my guilty pleasure is definitely pancakes.
I love
I'm
it.
addicted.
Yeah. All right. Now,
Yeah.
Dominique, if you were in healthcare, what career would you be in and why?
That's a good question. I think fashion or
Oh,
makeup. I absolutely love to do my makeup.
oh,
You might say, why you wear makeup? Because I like it. It's absolutely beautiful on us women done correctly.
yeah.
I love the difference that it makes in your outfit. Even just the different change in your lipstick. I
Yes.
absolutely love makeup. I think it's fun. I taught myself how to do it
Okay.
from YouTube and Pinterest is how I taught myself how to do makeup. So probably a makeup artist or fashion. I love clothes. I love to be. I'm always the friend that's like, oh, we're doing this. With sometimes I can be a little over the top in the way that I dress. So I would say fashion and makeup. I
Well,
absolutely
you
love
are beautiful, so we see it
it.
in
Thank you.
you. But we're glad that you became the healthcare professional,
Yes,
but you
yes,
can still wear your beautiful makeup and look beautiful
yes.
as well while you're doing it. So,
Thank you.
all right. So, how do you see the future of direct primary care evolving, especially in the areas of HRT and weight loss management?
So direct primary care is different from traditional primary care, right? I already see the difference with
Okay.
compared to traditional healthcare, which only uses insurance,
Okay.
compared to direct primary care, which is a subscription-based model.
Mm,
That model is so different because we are not trying to see 20, 30 patients a day.
okay.
Our time is not limited. You get the time that you need with your patients. It is patient focused. And it has helped so many patients that financially can't afford insurance. So, subscription based meaning 75 to 85 to $100 a month depending on, the program, right?
Right.
And when you are in those subscription based program, the provider caters to you, right? It's not a you see me, I run your insurance so that your insurance can pay me, and then they don't want to take care of certain things.
Right.
Whereas direct primary care, I can take care of you exactly how I see fit without the insurance and stepping in my way saying, I'm not going to pay for that, knowing that the patients need this, that, or the other, or a certain type of medication. So it's allowing you to completely take care of your patient from head to toe instead of you only can ask me one or two questions because the insurance is only going to, pay me for a certain amount of time or visit. Whereas direct primary care, let me fix what I can right now. Let me do the best that I possibly can without restricting you or pushing you out the door really fast, without you having the copays, without you having the expensive medications. It's a more affordable way to take care of your patients without sacrificing their care. Okay. So I already see when it comes to primary care that direct primary care is already, I would say outshining or making our patients better compared to the traditional primary care. So I see the changes with hormone replacement therapy and weight loss because insurance will only cover certain types of weight loss medications or hormone medications, like if it is a pill instead of an injection or cream or patch, or if it is weight loss, if it is the pill compared to the injections that's out now that's making a huge wave and change, right? They won't pay for that because it's so expensive. Whereas if you can get the patient to their weight loss goal, a lot of the things that they have or disease factors or comorbidities that's going on can be resolved because you've got their weight under control. You can get them off of blood pressure medication and the diabetes for the type 2 from what? Lifestyle, from
Right.
their weight, right?
Mhm.
So in the acne for most women and the dark spots in their face, all of these things from hormones and weight loss, if you treat that outside of the insurance, it can really help so they won't have to need a lot of the transplants in the kidney failure from the blood pressure that went unnoticed for so many years and the surgeries from for the obesity. If you can get it down with these medications, they don't have to go through the surgery. So I definitely think it would make it's going to make a huge difference in healthcare. And once people get a hold of it and understand the difference with direct primary care compared to the traditional using my insurance primary care, they'll see that their health completely changes and evolves because the insurance tells us what we can and can't do a lot of times.
Right.
But when you don't have that in the way, you can treat your patients, I feel, more effective. Yes, I offer both options. So people probably say, well, you offer more options.
Yeah.
I do offer both of them because some people say, but I want to use my insurance. Okay, but then when you come back with a high deductible or a big copay, I didn't know it was going to be that much. You try to warn them, you try to forewarn them, you try to give them a heads up. So, but if you just do the primary care, it's only this much a month and you don't have any outstanding bills for anything that's outside of that. You know what I mean? You don't have to worry about that. So I think it's going to make a huge difference. And I think people are starting to get more aware of their health right now. And they want to be healthy and they want to break the generational curses that we talk about with
Yes.
health, and they want to do better. And the more that people want to do better, they will start looking for providers who actually want to hear them and take care of them. And then they will start understanding more about the direct primary care model and they'll start getting on board and they'll see, okay, wait a second, their insurances are preventing me from doing this, or that. But if I do it this way, all of this can get taken care of and I can get healthy and don't have to be on 15 or 20 medications. I think it's going to make a huge change. I think it's really going to help evolve our healthcare system.
Most definitely. And let me say, this has been such an enlightening conversation.
Hmm.
Dominique, what are the future goals for Purposely Evolving Medical Clinic?
So to expand, my goal is to expand. I just let everyone know I'll be launching my telehealth services in Iowa. I just got my license in Iowa. So I will be, thank you, thank you.
Yes,
So
yes,
not only
yes.
that, all of Florida, I can treat all of Florida, even through telehealth. So I think expanding, trying to reach as many people as possible to give them the services that they deserve. So just expanding my clinic as much as possible, bringing on another nurse practitioner that has the same vision and goals as me, and expanding to Illinois. That's my home base. I'm from Chicago. So also expand telehealth there. I want to expand to as many people as possible to let them know that your health is important. You don't have to be, overlooked. And I want to make sure I tap into as many resources as I possibly can to get the word out that I'm here. And the name says it for itself. I'm going to intentionally change healthcare one patient at a time.
I love it. I
One
love it. And
patient.
I am so honored because anytime I talk to our healthcare professionals, I just learn so much. And then I'm just honored by the work that you do and how you really
Thank
care for
you.
the patient. That's
Thank
so
you.
important. So important. So, where can we come see you, follow you? I'm so glad that you're doing telehealth now. Like,
Thank
give
you.
us the information so we can come find you and get treated and feel like we, can live a long and healthy life.
Yes, I would love that. So you can, of course, we have Instagram. You can follow
Okay.
us there, Purposely Evolving. On Facebook, it's the same, Purposely Evolving Medical Clinic. That's there. You can go on our website, which is purposelyevolving.org. You can give us a call. I can give you guys the number is 727-937-6060. You can always give us a call. You can call for a consultation. You can, see us. I even just made a TikTok.
Oh,
I just made
okay.
a TikTok. I don't know how I feel about that yet, but
Okay.
you can follow us on there, Purposely Evolving as well. So we can just give as much information as we can because we want to reach as many people as
Yes.
possible.
Yes. All right.
Yeah.
Well, thank you so much
Thank
for
you.
conversing with me. And I look forward to all the wonderful things that Purposely Evolving Medical Clinic is going to do. All
Thank
right.
you so much for
All
having
right.
me. Thank you.
Bye. Remember, self-love is sexy. Be selfish in your love for self and selfless in your love for others. If you enjoyed this video, like it. If you found it useful and want to see more, subscribe. If it pertains to someone you know, share it. And if you have an opinion, leave a comment. A conscious heart will do all four. Thank you.